Hi, I'm Dr. Hasan Sheikh with Canadian Doctors for Medicare. Now, a lot of people are talking about privatization in the healthcare system right now. But before we can talk about privatization, we need to understand exactly what that word means in the context of the Canadian healthcare system. Canada's single payer, publicly funded healthcare system, which we call Medicare, is a public insurance plan where the government is the sole payer for services that are covered under each of the 13 provincial and territorial insurance plans. Those insured services, for the most part, just cover hospital and physician services. And that's about 70% of healthcare spending. The other 30% of healthcare spending in Canada is actually already private pay, out of people's pockets or through private insurance. The 70% that is publicly funded can be delivered in a number of different ways, including publicly owned facilities, things like community health centers, public health clinics, and many hospitals outside of Ontario. It can be delivered on a private but not-for-profit basis, which applies to a lot of hospitals within Ontario. Another way the care can be delivered is through small businesses that are physician-owned, things like doctor's offices. And the final category is through private, for-profit, investor-owned delivery models. Examples of these models include some walk-in clinics, high-volume virtual care platforms, and some private surgical clinics. We often hear these calls for the expansion of private healthcare when the healthcare system is under strain. These calls come in one of two ways. The first is private pay, where you allow individuals to pay out of pocket or through private duplicative insurance for healthcare that is currently publicly funded. And the other way is through an expansion of private, investor-owned delivery models. And that's using public money to pay for care that is delivered in a for-profit investor-owned facility. Proponents of privatization often conflate private pay and private for-profit delivery. They claim that increasing private pay and private for-profit delivery, or even both, will reduce wait times, both overall and within the public system, that they'll reduce costs to the public system, and that they'll lead to better health outcomes. But these are myths. Myths that have been thoroughly disproven by the evidence. So let's look at these myths one by one, see what the real story is, and talk about actual solutions that will make your healthcare system more accessible, more efficient, and higher quality.